Health stakeholders in the country have called on government to take more measures to address issues pertaining to malnutrition across the country. They make this known at a launch of project Catalyzing Strengthened Policy Action for Health, Diet and Resilience in Abuja. The project, which is aimed at addressing the nutritional needs of the most vulnerable population, women and children, is seeking a collaborative approach to ensure solutions aligned with the needs of the people and the nation's goals.
Statistics reminds us of the urgency of our collective action as a people. Malnutrition in its various forms hinders the physical and cognitive development of our children, jeopardizes maternal health, and places an additional burden on our healthcare system. Yet, in the face of these challenges, we should be standing united in seeing how we respond to the situation. And the key issues around this, the key focus of this project is to increase access to and consumption of healthy diet amongst household members, particularly women of reproductive age and children under 5. Increase the resilience of households to price shocks and economic stress that impact nutrition outcome.
The success of Cascade, just like any other project, hinges on collaborative efforts, and we are privileged to have partners not just at state level but at the national level, which share our vision for healthier diets for all Nigerians from a resilient and sustainable food system. Indeed, Cascade project is a remarkable project happening at a time when the conversation about nutrition, food, and climate is getting bigger, and so the linkage between food, nutrition, and climate is getting bigger and more relevant. This moment signifies not just a launch event, but a commitment to catalyzing transformative change in the fight against malnutrition and building resilience against economic and climate shocks. And I extend my heartfelt gratitude to each one of you for being part of this significant occasion.
This program is a unique opportunity to support Nigeria, its government and its people to strengthen food pathways and the nutrition status. At the same time, we're not just doing this in Nigeria, we're doing this in 6 countries around the world, and that's also a unique opportunity because it allows to have that exchange and to learn from each other and to see how things are happening somewhere else and how we can together come and improve things. When we're working on climate, we cannot forget that it has an impact on nutrition, and when we're working on nutrition, we cannot forget the impact that it has on climate. I think there's 25 to 30% of the global emissions are a result of food productions one way or the other. So it's important to keep that in mind whilst we're also implementing this program.
We are one of the most luckiest states that have enjoyed from this care program, perhaps more than any other states. 5 local government areas are involved, and they are listed in the program, and it's tremendous. The results, the women, the children, and including the men, have their conditions improved, have their life bettered, and so on and so forth. So the nutrition and all other things that are supposed to help keep life going is very much enjoyed in Bauchi State.
The government has also demonstrated commitment over time to strengthen investments in food and nutrition by developing the National Food and Nutrition Policy and the implementation manual referred to as National Multi-Sectoral Plan of Action that will enable each and every stakeholders to know what and what should be done, as well as associated guidelines aim at strengthening policy implementation and creating enabling environments for service delivery to thrive. The government has also demonstrated leadership globally on the implementation of the priority actions that will change the narrative of our food system from the farm to the dining table, with coordination by the Federal Ministry of Budget and Economic Planning.